So in today's video, we're going to be talking about heart failure. Why do people experience heart failure? So the heart is located in the thorax, between the two lungs. The heart is a vital organ that functions in the circulation of blood. So let's go further talking about heart failure. Why do we experience heart failure? What's the cause? So heart failure is the inability for the heart to pump blood properly for proper circulation. But before we go further, let's understand the anatomical portion of the heart and its function. So the heart comprises of thick muscles called the myocardium. Those muscles are responsible to contract and allow the pump of blood for circulation. The heart comprises of 4 chambers. We have the right and left atrium and the right and left ventricle. The heart also comprises of 4 valves. We have the tricuspid valve, the pulmonary valve, the bicuspid valve or mitral valve, and the aortic valve. How does the heart circulate blood? Blood flow from the body, which are deoxygenated from the upper portion and flow into the right atrium through a large vein called the superior vena cava, and blood flows from the lower portion of the body into the right atrium through a large vein called the inferior vena cava. Upon the heart contraction, the right atrium flows blood into the right ventricle through the valve called the tricuspid valve, and then the tricuspid valve closes. Upon another contraction of the heart, blood flows through the pulmonary artery into the lungs through a valve called the pulmonary valve. Blood flows through the lungs through tiny vessels and move to the alveolar sacs, where carbon dioxide is being taken and then the blood is given oxygen. So the process of oxygen being given to the blood is done within the alveolar. Those oxygenated blood are then moved into the left atrium through the pulmonary veins. The heart contracts and allows oxygenated blood to move to the left ventricle. Upon further contraction, blood moves through the aortic valve and then circulation happens. Now the heart functions to take away waste products and then transfer nutrients to the rest of the body. But how does heart failure happen? If any part of the heart muscles or the heart valve does not function well, it leads to heart failure. So we will begin from the common ones. So number 1, we have hypertension, which is high blood pressure. So high blood pressure happens when the blood is forcefully penetrating the arteries with high pressure that determines a high blood pressure towards the heart. It can affect the heart muscles contraction and leads to heart failure. 2, we have diabetes mellitus. High blood sugar has a bad effect on the heart, can cause heart failure. 3, we have the consumption of heavy alcohol. Heavy intake of can lead to heart failure. We have smoking, most especially tobacco, can lead to heart failure. So all of these things, they have negative effects on the heart that will alter the function of the heart. It's either the heart muscles or the heart valves, or create something we call multiple sclerosis, narrowing of the heart vessels, the arteries. We have the valvular disease. Under valvular disease, we have tricuspid regurgitation and mitral regurgitation. So Like we said, tricuspid regurgitation, when blood flows from the superior vena cava into the right atrium, upon contraction of the heart, the right atrium then sends blood through the tricuspid valve into the right ventricle. The tricuspid valve is expected to close so as to prevent backflow of blood from the right ventricle to the right atrium. But the inability of the valve to close and it remains open as a result of the valve being weak will allow backflow of blood into the right atrium. So this can cause heart failure. Same way with the mitral valve. Other causes follow. There are two cells that controls the contractions of the heart. Number one is the sinoatrial node. The sinoatrial node is found at the atrial muscles, and then the atrioventricular node is also found at the muscles towards the ventricles, between the ventricles. So upon contraction, the first signal comes from the SA node and then sent to the AV node. The atrioventricular node follow divide into two bundle branches and spread downward towards the two ventricles with two fibers which are called the Purkinje fibers. So all of these processes are normal and they should function normally, but blockage of those cells can inhibit the contraction of the heart. So as a node signal is blocked, can cause active contraction. It's either partial blockage or complete blockage, which can lead to heart failure. So heart failure is real. Let's take our health serious. The other cause could be congenital heart disease. Child can be born with the abnormal structure of the heart, abnormal valves, abnormal vessels, and this can lead to future damage, future heart failure. So our previous video, we did a video of proper diet for a pregnant woman, for the good health of an unborn baby, the formation of organs, good formation of organs which involve the heart, the lungs. Those diets are good. So follow this video and get more details on a good diet for a pregnant woman to avoid same congenital heart disease. Other causes we have the use of certain drugs such as the beta blocker and the calcium channel blockers. Go for a regular health checkup. Do your body chemistry, check your liver function, your kidney function, check for cholesterol, your lipid profile on regular basis. This will help you, and like we said, go for your EKG. Symptoms of heart failure: you have dizziness. Depending on the kind of heart failure you experience, you will have difficulty breathing, you will have swelling of the feet, and experience something we call patent edema. When you touch the feet or the leg with your finger and press it in, there will be a little pit left. You have chest pain, difficulty breathing, sweating a lot. Thank you very much for watching. Please subscribe, like, comment. Follow this page. This is Dennis Odicious. At the end of our presentation, we always have references so that you will not doubt. You just do a follow-up and get a confirmed information. The information we are giving, we have our mentors. So thank you so much.